Welcome to the Enlightening Nest channel, and today we are discussing about the effects of drugs in prenatal development. As we have been discussing earlier, that whenever you are planning to become pregnant, you need to take care of yourself because it will affect the development of the fetus in the womb. This means that you are not supposed to take drugs which are not prescribed by your obstetrician or gynecologist, because they go directly to the brain of the fetus. This means that your fetus feeds through the placenta. The drugs that you take, and they are not prescribed by your medical personnel, they will affect directly the fetus development. And so, if it affects the development of fetus, it means that you can get a child with low birth weight, physical defects, disabilities like autism, cerebral palsy, attention deficit, hyperactivity disorders, all those Down syndromes, all those, they may not necessarily be from the genetics, because the genes, nature and nurture also affects the prenatal development, but the environment that you are keeping your child or your baby in the womb, it will affect so much the development of that fetus, how the baby will come out looking like, even the facial expressions, they will be affected by the whatever you are taking. So to start with, let's start with the over-the-counter drugs. These are called opioids. When you take them, like painkillers, you feel headache, you go to the chemist or where the drugs are sold, you buy Panadol. They affect the child too much. You can get a child with a low birth weight. Then the child also can develop neonatal abstinence syndrome. This means that when you are giving the child the same drugs, when maybe the child is having pain or is having some problems, the drug will not be effective to the child because the child has been taking the drug through you yourself as a parent. So we need to take care. Then you can get a preterm labor. Maybe the labor comes very early than it was supposed to be. If it is 40 weeks, you get maybe the child at 36 weeks. This means that the baby will be kept in the nursery up to that time. And remember the environment, when the baby is in the womb, the environment is safe than when it is outside. Outside there are so many risks, and you are the one who caused those problems. Then it can also lead to restricted growth. Those are the over-the-counter drugs. Let us go to alcohol. We are always told there is no safe amount of alcohol to take when you are pregnant. Any amount is effective. Alcohol goes directly to the fetus. Like we said, it goes directly to the brain. and now the baby feeds that alcohol. This means that you will get a child with fetal alcohol syndrome, and this is very serious. And I said last time, I don't know how the doctor deals with that, because now the child will be craving for the alcohol after birth. Not unless maybe, I don't know how it happens, but the doctor knows how to deal with it. Imagine, and it is something that you could have witnessed. After 9 months, you get your child, now you can do your things. Let us take care. Stillbirth. The child, alcohol can make the child to die in the womb. Those complications. Facial expressions. The child can be deformed just because of the alcohol that you are taking. Because alcohol is not taken in a very good environment. It means the environment is always unconducive to the fetus. Then we have talked of the fetal alcohol syndrome, physical disabilities, and also behavioral and intellectual disabilities. The child can be behaving in an awkward way, not normal, just because of the alcohol that you take in the during prenatal period. Intellectual disabilities. The child does not understand anything. And you are wondering, why is my child being like this? As parents, can we avoid this? When it comes to learning, dysgraphia, dyslexia, all these learning disabilities, dyscalculia, the child will be having all these problems just because of something that you took without your knowledge. Can we take care? So now we go to stress. Chronic stress affects a child too much. Remember, stress makes the body to release hormones like adrenaline, cortisol, and these ones, when they are released in a very high amount than normal, they will be affecting the normal functioning of the child. So the child develops what? Anxiety. Just in the womb, the child is anxious. Imagine, and it is something that you could have controlled. Then it can lead to high levels of stress, can lead to the blood, reduced blood flow in the uterus. And remember, the blood is needed to feed and also when you be giving birth. Anoxia is very serious. Lack of oxygen when you are giving birth, it leads to cerebral palsy. Most of these problems, like cerebral palsy, they are caused by lack of oxygen during birth. You are unable to push the child or the baby out just because of lack of oxygen. So it can also a high amount of stress can also lead to premature birth, low birth weight, and also developmental delays in the infancy. During infancy, you find that the child is not completing the milestones as they are required. When it comes to language development, the child is not talking in the usual time. Social development is unable to interact even with the environment and or with the people surrounding him. Cognitive development, all this, you find that they becomes a problem just because of the amount of stress that you induced to your child when he was in the womb. Let us take care. Then trauma. Trauma, we are always told, it is an extraordinary happening. This one, trauma sometimes cannot be controlled. But when it comes, we are always told, if you know and you notice that you are pregnant and it is something that you cannot control, know how to handle it. Just because of the safeness and the security of that child. Because you want your child to be safe. Know how to control, know how to react. Make sure, however you are reacting, it will not affect the child. It can lead to uh, placenta disruption, that is trauma, low birth weight, the baby dying in the womb, premature delivery, stillbirth we have talked about. Then internal bleeding. Imagine all this mayhem. Internal bleeding, you know, it is very serious. It can lead to the death of you as a mother and also the fetus. So parents, as we continue engaging ourselves, I don't know how your experience has been, or maybe could one of these uh, things that we have discussed have led maybe to a problem or a certain issue that maybe you could have controlled or you did without your knowledge. Can we share our experiences? Can we comment on the comment sections? And don't forget to subscribe. Thank you for watching.